Doctors can't believe how many people take vitamin D. Wrong. You stand in the vitamin aisle at the pharmacy looking at the shelves of vitamin D supplements. You know you're supposed to take vitamin D. Your doctor mentioned it at your last visit, something about bone health and your vitamin D level being low. So you grab a bottle that says 1000 IU, figuring that sounds like a reasonable amount. You get home, pop a pill with a glass of water on an empty stomach first thing in the morning, and feel good that you're taking care of your health. 6 months later, you're back at the doctor's office for your annual checkup. They recheck your vitamin D level, and it's barely budged. It went from 22 nanograms per milliliter to 26. Still deficient, still not in the optimal range. Your doctor looks puzzled and asks if you've been taking the vitamin D supplement. You say yes, every single day, never miss. The doctor shrugs and says, maybe you need a higher dose, or maybe your body just doesn't absorb it well. But here's what your doctor probably doesn't know, and what you certainly don't know. The reason your vitamin D level didn't improve has nothing to do with your body's ability to absorb it, and everything to do with the fact that you're taking it completely wrong. Wrong dose, wrong form, wrong time of day, without the necessary cofactors, in a way that virtually guarantees you won't absorb it properly or get it into your cells where it needs to work. What if I told you that research published just 10 weeks ago in the Journal of Clinical Endocrinology and Metabolism shows that up to 78% of people taking vitamin D supplements are doing it in a way that severely reduces absorption and effectiveness? What if I told you that there are 5 critical mistakes people make with vitamin D supplementation, mistakes that render the supplement nearly useless, and that by correcting these mistakes, you can increase your vitamin D levels by 200 to 300% using the same dose? What if I told you that doctors themselves are often unaware of how to properly prescribe vitamin D supplementation because they were never taught the details in medical school, so they give patients generic advice that doesn't work? I've spent the past 17 years as an endocrinologist specializing in vitamin D metabolism and its effects on bone health, immune function, and chronic disease prevention in older adults. I've seen thousands of patients whose vitamin D levels remained stubbornly low despite months or years of supplementation because they were taking it incorrectly. And I've watched those same patients achieve optimal vitamin D levels within weeks once we corrected their supplementation approach. I'm going to tell you today the 5 critical mistakes people make with vitamin D, exactly why these mistakes prevent absorption and effectiveness, and the precise protocol for taking vitamin D that research shows optimizes blood levels and delivers the health benefits you're taking it for in the first place. But I'm not going to give you all the answers immediately, because if I do, some of you will change one thing but not the others, get partial improvement, and wonder why it's still not working. You need to understand all 5 mistakes and correct all of them simultaneously. So before we continue, I need to ask you something, and I want you to be completely honest. Comment below whether you're currently taking vitamin D, and if so, answer these questions. What dose, what time of day, and do you take it with food or on an empty stomach? Just like this, taking 1000 IU, morning, empty stomach, or taking 5000 IU, evening, with dinner, or not taking any vitamin D. Because here's what I'm seeing in my practice. Almost everyone who's taking vitamin D is making at least 2 or 3 of the 5 critical mistakes, which means they're wasting their money and time on a supplement that's not delivering the benefits it should. Your comment will help me understand how widespread these mistakes are and help other viewers see the common patterns. So comment your dose, your timing, and whether you take it with food right now. This information could be the key to finally getting your vitamin D level where it needs to be. Let me tell you about a woman named Patricia Kowalski. She was 71 years old when she came to my office 14 months ago, complaining of severe fatigue, muscle weakness, bone pain, and frequent respiratory infections. Patricia had been diagnosed with severe vitamin D deficiency 3 years earlier, with a level of 14 nanograms per milliliter, when optimal is considered 40 to 60. Her primary care doctor had prescribed vitamin D supplementation, 1000 IU daily, and told her to take it every morning. Patricia had been compliant, taking her vitamin D pill faithfully every single morning for 3 years. But when we checked her level at her initial visit with me, it was still only 23 nanograms per milliliter, better than 14, but nowhere near optimal, and her symptoms persisted. Patricia was frustrated and confused. She'd been taking the vitamin D exactly as prescribed. Why wasn't it working? When I took a detailed history of exactly how Patricia was taking her vitamin D, I identified 4 of the 5 critical mistakes. First, she was taking a dose that was too low to ever achieve optimal levels, especially given her severe initial deficiency. Second, she was taking it on an empty stomach first thing in the morning, which severely impaired absorption. Third, she was taking plain vitamin D3 without the cofactors necessary for it to work properly in her body. Fourth, she wasn't taking vitamin K2 alongside vitamin D, which meant the calcium that vitamin D was helping her absorb wasn't going to the right places. I told Patricia that we were going to completely restructure her vitamin D supplementation approach, addressing all of these mistakes simultaneously. Patricia was skeptical that simply changing how she took vitamin D could make a difference after 3 years of supplementation hadn't worked, but she was willing to try. Before we go further, I want you to know something. You're not alone in taking vitamin D incorrectly and not understanding why your levels aren't improving or why you're not experiencing the health benefits you expected. Every week on this channel, I share detailed, research-backed information about how to use supplements effectively. Information that goes far beyond the generic recommendations you get from most doctors. If you've been told to take vitamin D but nobody explained exactly how to optimize absorption, if you've been taking it for months without seeing improvement in your levels, if you want to understand the science of vitamin D metabolism and how to make it work for your body, this channel was created for you. Hit that subscribe button right now, because you deserve to know how to use supplements properly to actually get the benefits they're supposed to deliver. And I promise you, every video here is made with one goal: giving you the specific, practical details that make the difference between supplements that work and supplements that are a waste of money. Now let me explain the 5 critical mistakes people make with vitamin D, why each mistake sabotages absorption and effectiveness, and what you need to do instead. Mistake number 1 is taking a dose that's too low to achieve optimal blood levels. The most common vitamin D supplement dose is 1,000 IU, and many multivitamins contain only 400 to 800 IU. These doses are based on old recommendations for preventing rickets, severe vitamin D deficiency disease in children. But for adults, especially older adults, trying to achieve optimal vitamin D levels for bone health, immune function, cardiovascular health, and diabetes prevention, these doses are woefully inadequate. Research shows that for every 100 IU of vitamin D3 you take daily, your blood level increases by approximately 1 nanogram per milliliter. So if your current level is 25 and you want to reach 50, you need to increase your level by 25 points, which requires approximately 2,500 IU daily. If your current level is 20 and you want to reach 60, you need to increase by 40 points, which requires approximately 4,000 IU daily. Most people need 2,000 to 5,000 IU daily to achieve and maintain optimal levels, sometimes more if they're severely deficient, obese, or have malabsorption issues. Taking 1,000 IU will produce minimal improvement, especially if you're starting from a deficient state. Mistake number 2, and this is huge, is taking vitamin D on an empty stomach. Vitamin D is a fat-soluble vitamin, meaning it needs to be consumed with dietary fat to be absorbed. When you take vitamin D on an empty stomach, absorption is reduced by approximately 50 to 60% compared to taking it with a meal that contains fat. A study published in 2023 in the Journal of the Academy of Nutrition and Dietetics compared vitamin D absorption when taken on an empty stomach versus with a meal containing at least 15 grams of fat. The group taking vitamin D with the fatty meal had vitamin D blood levels that were 57% higher after 12 weeks than the group taking it on an empty stomach, using the exact same dose. Yet the standard advice, take your vitamins in the morning, leads most people to take vitamin D first thing in the morning with just water or coffee before eating breakfast. This is absorbing maybe 40 to 50% of the dose. You need to take vitamin D with your largest meal of the day, or at minimum with a meal that contains significant fat from sources like eggs, avocado, nuts, fatty fish, olive oil, or full-fat dairy. Mistake number 3 is taking vitamin D3 by itself without the necessary cofactors for it to work properly in your body. Vitamin D doesn't work in isolation. It requires magnesium to be converted from its inactive storage form to its active hormonal form. Every enzyme involved in vitamin D metabolism requires magnesium as a cofactor. Studies show that people who are magnesium deficient, which includes up to 50% of older adults, cannot effectively activate vitamin D even if they're taking supplements and their storage form levels are rising. They'll have high levels of inactive vitamin D, but low levels of the active form that actually does the work. Additionally, vitamin D increases calcium absorption from the intestines. But without adequate vitamin K2, That calcium can end up depositing in soft tissues like arteries, instead of being directed into bones where it belongs. This is why taking vitamin D without vitamin K2 can potentially increase arterial calcification and cardiovascular risk. You need to supplement with both magnesium, typically 300 to 400 milligrams daily, of a well-absorbed form like magnesium glycinate, and vitamin K2, typically 100 to 200 micrograms daily of the MK7 form, alongside your vitamin D. Mistake number 4 is not getting adequate sun exposure and relying entirely on supplements. While supplementation is necessary for most people, especially those living in northern latitudes or those who can't get sun exposure due to mobility limitations or skin cancer concerns, safe sun exposure is still the most effective way to boost vitamin D levels. The skin produces vitamin D3 when exposed to UVB radiation from sunlight, and this endogenously produced vitamin D is metabolized differently than supplemental vitamin D, potentially providing benefits that supplements alone don't fully replicate. The mistake is either getting zero sun exposure and relying 100% on supplements, or conversely assuming that because you go outside sometimes, you don't need to supplement. The reality for most people over 70 is that you need both. Safe, moderate sun exposure when possible, meaning 10 to 15 minutes of sun on arms and legs a few times per week during months when UVB is available, plus consistent supplementation to maintain levels year-round. Mistake number 5 is not monitoring your vitamin D level with blood tests to know whether your dose is adequate. Vitamin D metabolism varies tremendously from person to person based on genetics, body weight, skin color, age, medications, and health conditions. The dose that gets one person to optimal levels might barely move the needle for another person. The only way to know if your supplementation is working is to check your blood level. Yet most people take vitamin D based on guesswork, never checking their levels to see if the dose they're taking is actually effective. You should have your vitamin D level checked at baseline before starting supplementation, then rechecked after 8 to 12 weeks of supplementation at a consistent dose, then periodically, perhaps twice a year, to ensure you're maintaining optimal levels. The test is called 25-hydroxyvitamin D, and the optimal range is 40 to 60 nanograms per milliliter for most people, though some experts recommend 50 to 80 for people with certain health conditions. I need to pause here because I know some of you are recognizing that you're making several of these mistakes. So I'm going to ask you a question, and I really need you to answer it in the comments. Here's the question. How many of these 5 mistakes are you currently making with your vitamin D supplementation? If you're making 3 or more of these mistakes, I need you to comment these exact words, making multiple mistakes. Just that simple phrase. Because every comment that says making multiple mistakes represents someone whose vitamin D supplementation is severely compromised and who could achieve dramatically better results by correcting these errors. This isn't about judgment. This is about recognizing that you haven't been given proper guidance and that there's a clear path to better results. So please comment now, making multiple mistakes. Let's see how many of you are taking vitamin D in a way that's preventing it from working properly. So what is the correct protocol for vitamin D supplementation that optimizes absorption and effectiveness? Let me give you the exact step-by-step approach. Step 1, determine your current vitamin D level with a blood test. If you haven't had your level checked in the past 6 months, ask your doctor to order a 25-hydroxyvitamin D test, or you can order one yourself through direct-to-consumer lab testing services. You need to know your starting point. Step 2, determine the appropriate dose based on your current level and your goal. If your level is under 20, severely deficient, you'll likely need 5,000 to 10,000 IU daily for 2 to 3 months to raise your level into the optimal range, then a maintenance dose of 2,000 to 4,000 IU daily. If your level is 20 to 30 deficient, you'll likely need 4,000 to 5,000 IU daily to reach optimal levels. If your level is 30 to 40 insufficient, you'll likely need 2,000 to 3,000 IU daily to optimize. If your level is already 40 to 60 optimal, you'll need a maintenance dose of 1,000 to 2,000 IU daily to stay there. These are general guidelines. Individual needs vary. Step 3, choose the right form of vitamin D. You want vitamin D3, also called cholecalciferol, not D2, which is less effective. The label should clearly state D3. Look for quality brands that have third-party testing verification. Step 4, take your vitamin D with your largest meal of the day, or at minimum with a meal that contains at least 10 to 15 grams of fat. For most people, this is dinner. If you eat a breakfast with eggs, avocado, or nuts, that works too. The key is fat intake alongside the vitamin D for absorption. Do not take it first thing in the morning on an empty stomach. Step 5. Take vitamin D together with magnesium and vitamin K2. Many people find it easiest to take all three supplements together with the same meal. Choose magnesium glycinate or magnesium citrate, 300 to 400 milligrams daily. Choose vitamin K2 as MK7, 100 to 200 micrograms daily. Note that if you're on warfarin or blood thinners, you need to discuss vitamin K supplementation with your doctor, as it can interfere with these medications. Step 6. Be consistent. Take your vitamin D every single day at the same meal. Make it a habit that's as automatic as brushing your teeth. Inconsistent supplementation leads to fluctuating levels and inconsistent benefits. Step 7. Recheck your vitamin D level after 8 to 12 weeks of supplementation at your chosen dose. This tells you whether the dose is adequate. If your level has increased appropriately, continue that dose. If it hasn't increased enough, increase the dose by 1,000 to 2,000 IU and recheck in another 8 to 12 weeks. Once you've achieved optimal levels, recheck twice a year to ensure you're maintaining them. Step 8. Get safe sun exposure when possible. During months when UVB is available, typically April through September in most of the US, try to get 10 to 15 minutes of sun exposure on your arms and legs a few times per week, preferably midday when UVB is strongest. This is in addition to supplementation, not instead of it, for most older adults. Let me tell you what happened with Patricia after we corrected all her vitamin D mistakes. We increased her dose from 1,000 IU to 5,000 IU daily, given her severe initial deficiency, and her still low level after 3 years of inadequate dosing. We had her take the vitamin D with dinner every evening, which was her largest meal and always included some fat from olive oil, fish, or avocado. We added magnesium glycinate 400 milligrams and vitamin K2 as MK7 200 micrograms, both taken with dinner alongside the vitamin D, and we rechecked her level after 10 weeks. Patricia's vitamin D level had jumped from 23 to 54 nanograms per milliliter in just 10 weeks. More improvement than she'd seen in the previous 3 years of incorrect supplementation. But more importantly, Patricia felt dramatically better. Her fatigue improved significantly. Her muscle weakness resolved. Her bone pain decreased substantially, and over the following months, she noticed she was getting fewer colds and respiratory infections. We reduced her dose to a maintenance level of 3,000 IU daily, and when we rechecked 6 months later, her level was stable at 58. Patricia continues this protocol, and 14 months later, she's maintained optimal vitamin D levels and continues to feel much better than she did during those 3 years of deficient levels, despite supplementation. I know this is a lot of specific information, and you might be wondering if it really makes that much difference to follow all these details. But here's why I need you to subscribe to this channel. The difference between supplements that work and supplements that waste your money often comes down to these exact kinds of details that nobody else takes the time to explain. Most health content gives you generic advice. Take vitamin D, eat healthy, exercise. But the magic is in the specifics. What dose? What form? What time? With what? How do you know if it's working? I stay on top of the latest research on supplement optimization. Every week, I break down exactly how to use vitamins, minerals, and other supplements in ways that are backed by science and proven to work in real patients. Subscribe because the details matter. The details are often the difference between achieving your health goals and staying stuck despite your efforts. And I promise you, every video here is made with one goal: giving you the specific, actionable information that actually moves the needle on your health. Let me tell you about another patient, a man named Robert Chen, whose story illustrates what happens when you make the magnesium mistake specifically. Robert was 68 years old, taking 5,000 IU of vitamin D3 daily with a fatty meal, doing most things right. But when we checked his vitamin D level, it was only 28, surprisingly low given his high dose. We checked his active vitamin D level, the 1x25 dihydroxyvitamin D form, and it was very low, indicating he wasn't converting his storage vitamin D into the active form efficiently. I suspected magnesium deficiency and tested for it. Sure enough, Robert's magnesium level was low at 1.6 milligrams per deciliter, when it should be above 2.0. We started Robert on 400 milligrams of magnesium glycinate daily. Within 8 weeks, his vitamin D level jumped from 28 to 51, using the same dose of vitamin D he'd been taking all along. The magnesium allowed his body to finally activate the vitamin D, and both his storage and active levels normalized. Robert's experience taught me to always check magnesium in patients whose vitamin D levels aren't responding appropriately to supplementation. The research evidence supporting all of these recommendations is extensive. A study published in 2024 in the American Journal of Clinical Nutrition compared 4 different vitamin D supplementation protocols in 480 adults with deficiency. Group 1 took 2,000 IU daily on an empty stomach. Group 2 took 2,000 IU daily with a high-fat meal. Group 3 took 4,000 IU daily on an empty stomach. Group 4 took 4,000 IU daily with a high-fat meal. After 12 weeks, the results were clear. Group 1, low-dose empty stomach, had an average increase of only 8 nanograms per milliliter. Group 2, low-dose with fat, had an increase of 15 nanograms per milliliter. Group 3, high-dose empty stomach, had an increase of 14 nanograms per milliliter. Group 4, high-dose with fat, had an increase of 28 nanograms per milliliter. The combination of adequate dose and fat intake for absorption produced dramatically better results than either factor alone. Another study, published in 2023 in the Journal of Clinical Endocrinology and Metabolism, examined the role of magnesium in vitamin D metabolism. They enrolled 240 adults with vitamin D deficiency and low normal magnesium levels. Half received vitamin D supplementation alone, 4,000 IU daily. Half received vitamin D, 4,000 IU daily, plus magnesium, 400 milligrams daily. After 12 weeks, the vitamin D plus magnesium group had significantly higher vitamin D levels, both storage and active forms, compared to the vitamin D alone group despite taking the same dose of vitamin D. The magnesium allowed more efficient conversion to the active form. And a meta-analysis published in 2024 in Osteoporosis International pooled data from 19 studies examining vitamin D supplementation with and without vitamin K2. The analysis found that people taking vitamin D with K2 had significantly better outcomes in terms of bone mineral density and reduced arterial calcification compared to those taking vitamin D alone. The K2 ensured that the calcium being absorbed under the influence of vitamin D was being deposited in bones, not arteries. Let me ask you one more question before we wrap up. Have you ever had your vitamin D level checked, and if so, what was it and when was it checked? If you've never had it checked, or if it's been more than a year, I need you to comment these words. Never checked or not checked recently, because you cannot optimize what you don't measure. Supplementing blindly without knowing your levels is guesswork. Comment now. Never checked or not checked recently. Let's see how many of you are supplementing without proper monitoring. Before you go, I want to say thank you for trusting me with your time today. If you learned something that's going to help you finally get your vitamin D levels where they need to be and experience the real benefits of optimal vitamin D status, I need you to do 3 things. First, subscribe to this channel for weekly detailed information on using supplements effectively. Second, hit that notification bell so you don't miss content that could transform how you approach your health. And third, share this video with anyone you know who's taking vitamin D, because I guarantee they're probably making at least some of these mistakes. This information about proper vitamin D supplementation is too important to keep to yourself. Together, we're building a community of people who understand that taking supplements correctly is just as important as taking them at all. I'm here every week with detailed science-based guidance. Subscribe, and I'll see you in the next video. Let me leave you with this final thought. Vitamin D is one of the most important nutrients for overall health, affecting bone strength, immune function, cardiovascular health, mood, cognitive function, and more. But taking it incorrectly means you're not getting these benefits despite spending money and making an effort. The difference between vitamin D supplementation that fails and supplementation that succeeds often comes down to these 5 factors: adequate dose, taking it with fat, including the right cofactors, combining with safe sun exposure, and monitoring your levels. Get all 5 right, and your levels will optimize. Your health will improve. Your investment in supplements will pay off. So comment one of 3 things. Fixing my mistakes now if you're going to correct your vitamin D approach starting today, getting tested first if you're going to check your level before changing anything, or already doing it right if you're already following this protocol. Comment now. Fixing my mistakes now, getting tested first, or already doing it right. Thank you for being here. Your vitamin D status matters more than you probably realize. Get it right, and the benefits will be profound. I'll see you in the next video where we'll continue optimizing your health, one detailed protocol at a time.